Anne is a 45-year-old woman. This is considered a young age to have frontal temporal dementia known as Pick's disease. This could vastly impact on her life in many social ways, such as her work life. She may have to take early retirement. This could not only leave Anne financially stressed, but also emotionally disconnected from the world that she knows. Her family life could also alter. Relationships could be strained as she loses identity within the family. Perhaps Anne might adopt the feeling of being the person who needs care now, rather than caring for her son that has cerebral palsy. It may interrupt with her husband. Sexual and emotional relationships may be damaged due to the loss of her role as a mother and a wife within the family unit. These could result in Anne feeling isolated or depressed. It is essential to obtain a patient's consent before any form of care is given. To assess Anne, it may be constructive to discuss with her how she is feeling. There may be a reason or some concerns of hers leading to a choice in not taking her antidepressants. Providing Anne with information and help to change her mind about taking her medication as a result of informed consent. It would be vital to assess Anne understands, and it is stated that a person has capacity to consent if they retain and understand the information given to them. This could become evident through talking to Anne if she understands the importance of her medication. If Anne still does not wish to take her antidepressants, a nurse must respect that decision of autonomy from the patient, as it is their wish, but the nurse should explain any outcomes or effects of not taking medical advice. It may help Anne's family to have support around them. The nurse could talk to the family to show that they want to support them and not just Anne, and demonstrate that it must be hard on the whole family. As the son is young, he may be finding it a challenge to deal with his mother being ill. Offering the son support in a form he understands could help overcome these difficulties. Videos are available from dementia support websites that the son could watch in his own time to assist him with information on how to cope. There is also a document called The Milk is in the Oven that is designed for children coping with a parent that has dementia. There are also support groups for families that might help the husband to acknowledge how Anne must be feeling, and for him to find support from other husbands and carers. With Anne's consent, they may wish to have a joint conversation about the future. It may help Anne to know that her wishes are known to the family, and that in time to come she may want her husband to be her advocate. It is important to care for Anne in a holistic manner, which includes her physical and mental health. Firstly, it would be important to care for Anne's burn that she is presented with in A&E, making sure guidelines are followed to clean and dress the wound, making sure there are no signs of infection. Also, to inform Anne and the family how to care for the burn and observe for signs of infection when home, providing information leaflets to help Anne so she can return to them for reference. Whilst Anne is in A&E, it may give the nurse a chance to discuss with her the problems she is facing at home, and stimulus to how she is feeling low. A nurse has a good opportunity to gain a therapeutic relationship with Anne, and it is important to gain Anne's trust. The nurse could have an informal interview with Anne to gain an understanding of which service might be of use to her. A personal diary could be kept by Anne. It is vital that the person-centred approach is kept to ensure care is delivered with Anne at the centre. Anne may find it comforting to know that any information she discusses with the nurse will remain confidential. Other services to be involved in Anne's care could be the community nurse, a GP and a dementia nurse specialist. The challenges that lay with interdisciplinary teams can be communication. It would be imperative to ensure that there is a consistency of care given to Anne to support her properly. One named nurse might help with this continuity of care, but it may not always be possible to stick with one person, which may cause Anne distress or frustration. Overall, it is important to make sure Anne is at the centre of the care, holistically caring for both her physical and mental needs. The family will also need to support to understand Anne's condition and how they can assist Anne to have good quality of life. Planning for the future could be an option for Anne, and building positive professional relationships so that Anne has a trusting bond with her health care professional team.